Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and today I have with me in the studio our friend, Professor Andrew Zamani.
Good morning,
Prof,
Father.
you're welcome.
Thank you.
You were here some 2 months ago or more for us to discuss COVID-19 and the challenges and so on and so forth. Weeks or months after, we are still stuck with COVID-19 with increasing numbers. Now, I think every state in the Federation has recorded numbers, and we're having Lagos and Kano and Abuja with very, very high numbers. And so it means the fear is still there, the panic is still there, the anxiety is still there. So I believe that we need psychologists more than ever before now. Psychologists should now be on the front line to defeat this pandemic and its consequences. By the way, Professor Zamani is former president of the Nigerian Psychological Association, is a professor of clinical psychology, and is the director of the Center for Institute for Governance and Development Studies at the Nasarawa State University, KEFI. Prof, once again, you're welcome.
Thank you.
So, COVID-19.
Yes.
And psychological care. There's been a lot of effort when they were talking of palliatives, for example. It is about simply serving food, making sure people have food because they were locked in. But being locked in has other consequences because of, beyond food, finding food to eat. Human beings are not meant to be locked in. Human beings are social beings. They are supposed to relate with people. They are supposed to hug people, even for our mental, emotional, spiritual well-being. Hugging people, shaking people, and so on. So you came into the studio, I couldn't shake you. What are the psychological impacts of all this, and how are we, particularly you, professional psychologists, what can you advise? How do we help so that people don't get into depression?
All right. Thank you, Father. Maybe I should just backtrack a little bit before I answer the core question. In the beginning, when we met, we tried to anticipate a lot of things that will happen,
yes.
And I think they have all played out. We examined the governance structure for Nigeria's response
to COVID-19.
And we felt that a lot needed to be done. We took a look at the health service system, and we both agreed, and I believe many of our viewers also concord, that our health service system was still a far cry.
We were not prepared for such an epidemic.
Still a very far cry in the response to COVID-19. We looked at the gaps in social relations, and we believed very strongly at that point, and it is playing out now, that in order for the government to achieve her good intentions for the initial response that she put in place, the citizenry needed to be carried along. Unfortunately, at the time that we discussed, we again both agreed that there was no strategic communication system in place to ensure that the narratives were evidence-based, and that we could, by such narratives, secure the trust of citizens to understand what they needed to do to keep safe. And now here we are with increasing cases of COVID.
Yes.
Now the question is, why the increase? Is it possible that things have gotten worse, or are we just beginning to see a manifestation of what has been? Now, it's really a very dicey question to answer, but I'll turn both sides. First, to say that because the state governments did not cooperate with the federal government,
there was no buy-in.
There was no buy-in by state governments. Each state government was virtually on its own, except for the FCT, Ogun State, and Lagos. Yeah, upon which the federal government made pronouncements. All state governors were on their own.
And I don't know whether up to now, my own state governor has agreed that there's COVID-19.
So, and then there was uncensored movements,
from state to state.
From state to state. And so people who took it probably from Lagos, transmitted it to Kano, to Plateau, and all other places.
Meaning the time that the president closed Lagos, Abuja, and Ogun, if the whole country was really shut down.
Yes. If the entire country was shut down, we probably would not have seen this. We probably would not have seen this. Okay, and so community transmission started up initial. We were more interested in symptomatic cases. We were depending on case finders. For clinical attention.
Did he just travel? And then
exactly.
Is he showing?
What's his travel history? Exactly. Is he coughing? And to the extent that we even had many false positives. People who were negative of COVID, who were forced into isolation centers, who were kept in isolation centers for 2 weeks, and together with those who had COVID. And so when they got negative results and they began to celebrate, no sooner than they left, they became positive of COVID. So this is the situation. Now, it's a public health situation that we all must appreciate. And we want to thank the federal government for at least making an effort, albeit defective, to set up a task force that is working around the clock
and addressing
Nigerians, giving us feedback and so on and so forth. And that is improving in its strategies by the day. We need to really appreciate that. We also need to appreciate the efforts of the federal government in constructively engaging state governors, because I think by now virtually 98% of them have bought in. And it would appear to me that the next stringent steps that will be taken on COVID will come from the states, led and supervised or oversighted by the federal government. Because state governments are beginning to feel the impact of COVID in their respective domains, especially because it spares no one. The high, the low, and the mighty are affected. So physical distancing is imperative.
Yes.
Again, this is one point in which we missed it, because we took hook, line, and sinker the guidance of the WHO
from the Western world.
Yes.
What's
social distancing, for God's sake? What's social distancing? Social distancing is a lot different from physical distancing.
So we could have begun with physical distancing and how it can work in our context.
Yes. And yet promote social bonding.
Yes.
You can be physically distant, but emotionally bonded. This was taken too far. And so social distancing also meant emotional detachment, psychological alienation, as well as physical distancing. And so you have people now who are mutually suspicious of each other. You go to a friend's office, and he sees you as a risk.
You are
for
bringing
COVID.
disease.
Yes,
you are bringing disease.
Exactly. You enter your house. Sometimes your wife or your children would tell you, "Look, Daddy, have you
decontaminated?
Have you decontaminated?" and so on. It's a good development. But the way and manner that we convey these things to each other is what is becoming an anomaly. We are talking about the new normal. The new normal should not also include pathologies in relationship, pathologies in mental functioning, and so on and so forth. And so,
some people can be paranoid about this safety.
No, that's one psychological pathology
and destroy family relations,
the fabrics of relationship
yes.
that have existed over
so
time.
Part of what the committees should be doing, part of what government agencies, orientation agencies, and part of the kind of education we should be giving is how you can do physical distancing and yet maintain your social bonding.
Exactly.
And how people should not be so paranoid that husband and wife are seeing each other as death threats.
Thank you. And you know what? If this happens in the context of the family, then there is sexual starvation, and either parties can take an abnormal step to find satisfaction.
So somebody says, "I don't know where you went during the day, so
exactly.
I can't sleep with you."
Yes, I can't sleep with you.
And then
yes. So the man is left to look at either his daughter or the house girl. Whoever he is close to and has power over. The lady, if she is the one that is being despised, would target the houseboy, the gate man, and so on and so forth. Or the slightest.
But what you are saying now for me is an abnormality. It will just being starved of sex by marital partner leads to that kind of abnormality?
It all depends. It depends on the level of obsession that people have with sex.
Okay.
The level of previous engagement they have had of sex.
Okay.
Yeah. Some are such that have hyper desires. They have extreme desires for sex.
So for such people, when they are starved,
yes,
they go crazy.
Yes. The second thing is that it doesn't matter what level of sexual desire people have. The fact that you have been despised by a partner who should understand
leads to a revolt.
It leads to a revolt. So it becomes a rebound reaction. All these things are really there. And then the mere fact that people can no longer trust each other to relate very closely.
I mean, the mere fact that neighbors are not able to come close.
Yes.
It poses quite some danger for neighborliness.
Yes. I mean, there's already emotional detachment from relationships, both within the family most of the time, within the neighborhood,
yes,
and then even at work. So the sense of collegiality becomes so affected that people begin to nurture a kind of conscience that is flat. And so it is difficult to get empathy.
Empathy suffers.
Yes, it suffers.
Of course, if you don't go close to somebody, you need to go close to somebody before your sense of empathy is aroused.
Yes.
So if you don't go close to people, if you see the next person coming as a potential COVID transmitter. I say somebody who can potentially bring you COVID. Now, then, of course, just that causes a block.
Exactly. Okay, Father, let me even give you an example. A friend loses a loved one.
Yes.
And, as a concerned party,
yes,
you want to identify with this friend.
With your friend who lost.
Who lost. Yeah, but because of COVID, your friend is not willing to receive you. You go to the friend's house and you are told that the friend is either sleeping or has gone out. And you are wondering, under this lockdown, where would my friend go? He's just been bereaved. Where would he go? Who would he be visiting? That's a signal. You have a rejection already.
Yes.
In the meantime, this friend, male or female, needs emotional, psychological support. So maybe groaning in loneliness,
grieving alone
a lot. That's one part. The other part is the fact that there are now rules, okay, about funeral ceremonies.
Yes.
So the normal or usual pattern that we're used to is no longer in place.
Coming around to support the bereaved and
thank you.
Attend the funeral.
Yes, and for the Christian faithfuls, you even have, towards the end, wake keep ceremonies where eulogies
and the body
are poured and so on. Yes, and you have the opportunity to have a closure,
to heal and get closure from this.
Exactly, it's no longer there. Our Muslim faithfuls cannot gather together in the normal way they used to do in the trenches of prayers.
Mm-hmm. For the 8 days from the time the person died.
They can no longer do it in that form. And then you go to the graveyard, and you are 4 or 5, or at most 20.
Rather than 1,000 that would have been there.
You are just like ghosts by the graveyard.
And even that you went to the graveyard, even though your brother didn't die of COVID,
yes,
the fact that you went to the graveyard
makes you a suspect.
Because maybe they didn't tell the truth.
So these are the issues. These are the issues that have to be intellectually interrogated. And let's be fair to government. I think that government is advancing, but the intellectual community
needs to
in Nigeria is lazy. I'll say that, because what we are doing right now is regurgitating information from abroad. Yes. We have local peculiar circumstances that we should interrogate and feed the policymakers.
Yes, that we belong to a society where communalism,
yes,
family bonding,
yes,
connectedness,
yes,
which is what was responsible for our mental health.
Absolutely.
So if we now lose a lot of this on account of COVID-19, what are our researchers doing in order to, what are intellectuals doing in order to contextualize our response to our circumstance?
Well, I don't know how to answer this question, but for me, I think it remains a challenge. The federal government, for instance, through the TED Fund and through CBN grants, have opened up to researchers in tertiary educational institutions to generate information that will guide policy. Now, the announcements have just been made, maybe in the past 3 weeks to 1 month. Let us give an additional 1 month to see what the response rate is like. And then we can come back to this studio, or any other fora to really check what is really going on.
By the way, somebody told me that your association, the Nigerian Psychological Association, had a meeting, maybe Zoom meeting, not long ago on the COVID-19.
We've had several meetings. Actually, the Nigerian Psychological Association has set up a national COVID response team.
Great. So,
and it is very well organized and coordinated. Right now, every state chapter has a COVID response team.
Okay.
We have engaged with NCDC, and we have acceptance to join their psychosocial policy meetings. We have engaged also with the Federal Ministry of Health, and we have weekly meetings with the Federal Ministry of Health, and we are making our own input. In fact, we have even gone beyond COVID. We have searched every function of the Federal Ministry of Health that requires psychological input: family health, public health, non-communicable diseases, even the pharmacy section that deals with drugs and substance abuse, and so on and so forth. And we have made written inputs, on what should guide their policy attention with regards to the involvement of psychologists in improving healthcare services.
Do you have some kind of network on social media, like WhatsApp groups and so on and so forth, so that when people see something useful that maybe the Koreans are applying, or maybe the Ugandans are applying on the psychological health area, that we can easily get your professionals across the country to be aware of and just domesticate it for use in our place?
Yeah, we have a Facebook account. Okay. We have a Twitter account. We also have a website. Yeah. So I think that this fora would enable us to interact, better with the public, gain from what the public has to share with us, the input that they desire, and to respond appropriately to it.
Yeah. On that note, we'll be bringing this session to an end. In Nigeria,
yes,
the awareness of psychological health has not been much. I mean, many people, in recent times, at least the elite, they know how to go for clinical medical checkup. They know how to, but you tell somebody to go for psychological assessment in order to know about his or her psychological health. And it's like, no, there's nothing wrong with me. So it's still a problem. Even with this COVID-19, with all the challenges that we are having on the emotional, psychological level that we have listed earlier, how do we really get Nigerians to recognize that we are body, mind, and spirit? And just as you go to consult your pastor, spirit, and you go to consult your medical doctor, body, that you need mind, you need your psychological well-being. You need to constantly check.
Well, Father, I think you have even provided some solutions in the past, and it is, these solutions are growing. The need for psychological health cannot be overemphasized, and the need for the entire citizenry to be aware also cannot be overemphasized. And the fact that everybody needs a psychologist cannot be overemphasized. In the context of Terra, for instance, Father George comes up and says, look, let us interrogate post-traumatic stress disorder from the psycho-spiritual perspective.
Yes.
And you have gathered hundreds of Nigerians in your institute. And, people for the first time got exposed to psychology, both in terms of knowledge and experientially, what psychology does to heal trauma. And so all the people that you gathered, or you have gathered, who came to learn about how to heal trauma, suddenly discovered that they were traumatized and needed to be healed of their traumas.
And now, you know what is happening? Now, some of them are becoming very useful in this COVID-19. I see on
Absolutely.
social media some of
Yes.
them organizing little workshops on
Yes.
social media
Yes.
to help people who are
That's the
traumatized.
benefit.
Yes.
So psychologists alone cannot do it.
Yeah.
We need people like you. We need civil society organizations that are oriented in providing mental health care, psychosocial support services, to really partner with us.
Thank you very much. On this note, bring it to an end. I've been speaking with Professor Andrew Zamani. I didn't mention at the beginning that apart from being the director of the Institute for Governance and Development Studies at Nasarawa State University and being former president of Nigerian Psychological Association, he's a lead faculty at Luke's Terra Leadership Foundation. You are.
Thank you.
We have been doing a lot of these psychology trainings with him at Luke's Terra Leadership Foundation, and we will have you again for more of this discussion because you are a powerful resource person in these areas. God bless you.
Thank you.